What if the most dangerous heart problem isn't the one your doctor finds? It's the one your routine blood test completely misses. Every year, thousands of people hear the words, "Your cholesterol looks fine." Then, just weeks later, some of those same people are rushed to the emergency room after a heart attack they never saw coming. How is that even possible? If your cholesterol is normal, shouldn't your heart be safe? The answer may surprise you. Your heart has been leaving clues all along. Most people simply aren't looking in the right place, and that's where today's story begins. A retired school principal named Margaret believed she had done everything right. She walked every morning, rarely ate fast food, never smoked, and faithfully attended every yearly checkup. Each visit ended with the same reassuring words from her doctor. "Everything looks good." Those words became part of her routine. Then one afternoon, while working in her garden, she felt pressure across her chest. She assumed it was indigestion. But within an hour, she was lying in a hospital bed after suffering a heart attack caused by a blocked coronary artery. Her family couldn't understand what had happened. Neither could Margaret. Her cholesterol had always been normal. Later, more advanced testing revealed something routine blood work had never measured. The warning signs had been present for years. They simply weren't part of her standard annual screening. Stories like Margaret's are far more common than most people realize, and that's exactly why this conversation matters. As a cardiologist, I've spent years caring for heart patients, and one lesson continues to surprise people again and again. Heart disease isn't always loud. In fact, it's often remarkably quiet. Your arteries can slowly change for years before any symptoms appear. Many patients feel completely healthy until the day everything suddenly changes without warning. That's why modern preventive cardiology has shifted its focus. Today, we don't just ask how much cholesterol is floating through your bloodstream. We ask a much more important question. What is your blood actually telling us about your future heart health? Think of your arteries like the plumbing inside a home. If you only measure the amount of water flowing through the pipes, you still don't know whether the pipes are rusting, whether tiny cracks are forming, or whether dangerous pressure is building behind the walls. Your cholesterol number tells only one part of the story. Most heart attacks happen because several hidden problems develop together over time. Inflammation, blood vessel damage, tiny cholesterol particles, abnormal clotting, and genetics all play important roles. When these risk factors combine, even a perfectly normal cholesterol level may not tell the whole story. Fortunately, newer blood markers can reveal much more about what's happening beneath the surface. Today, let's explore 5 of the most important ones. Most people think troponin is checked only after someone has a heart attack. That's true for traditional testing. But newer high-sensitivity troponin tests can sometimes detect tiny amounts of heart muscle injury long before symptoms ever appear. Why does that matter? Because your heart may be experiencing ongoing microscopic damage that you never feel. Research suggests that even small increases in high-sensitivity troponin may be linked to a greater risk of future cardiovascular problems. Imagine tiny scratches appearing on a windshield. One scratch barely gets your attention, but over many years, those small imperfections weaken the glass. In the same way, tiny amounts of heart muscle injury can gradually signal a bigger problem developing. The right response isn't to panic. It's to investigate what's causing those subtle changes. Sometimes it's uncontrolled high blood pressure. Sometimes diabetes or kidney disease. Finding the cause early gives you the best chance to prevent more serious problems later. Here's one blood test that almost nobody talks about. Many people regularly check their blood sugar, but far fewer measure their fasting insulin. Yet fasting insulin often becomes abnormal years before blood sugar starts to rise. That means your body may already be struggling, even while your glucose results still look perfectly normal. Chronically high insulin levels can contribute to inflammation, weight gain, and damage to your arteries long before diabetes is officially diagnosed. I once treated a patient whose blood sugar stayed within the normal range for years. However, his fasting insulin was already elevated. After improving his diet, losing weight, and becoming more active, his metabolic health improved dramatically. Because those lifestyle changes happened early, his blood sugar never progressed to diabetes. That's an important reminder that prevention often begins years before disease actually appears. Detecting problems early gives you valuable time to make meaningful changes. Your blood needs to clot because without clotting, even a small cut could become dangerous. But too much clotting isn't healthy either. That's where fibrinogen comes in, a protein that helps your body form blood clots when they're needed. Higher fibrinogen levels may indicate increased inflammation and a greater tendency for unwanted clot formation. Think of wet cement. A small amount helps repair the road. Too much starts blocking traffic and creates problems instead of solving them. Many studies have linked higher fibrinogen levels with increased cardiovascular risk. If your level is elevated, your physician may also evaluate other contributing factors such as smoking, chronic inflammation, obesity, or other long-term medical conditions. The goal isn't simply lowering one lab value. It's understanding why that number is elevated in the first place. When you identify the underlying cause, you have a much better chance of protecting your heart before a serious event occurs.